What kind of chiropractic care can treat scoliosis? When it comes to the conversation regarding the treatment of scoliosis, chiropractic care always comes into play. And people always ask, can chiropractors take care of scoliosis? Can they treat scoliosis? Can they help manage scoliosis? These are very valid questions. And before I kind of answer those questions, I kind of want to talk to you just a second about what scoliosis is. Scoliosis is a sideways curvature of the spine of 10 degrees or more, and there must be rotation involved as well. So it's 10-degree curvature from the front with some type of rotation. It's typically into the concavity of the scoliosis. This is a three-dimensional problem. It's not just a bend, it is a twist. A bend in translations are normally involved in this kind of problem. So it's not just a simple bend. Scoliosis is a very complex condition. It's not just misalignment. It can be associated with many other issues, and many different conditions can be associated with it, like neuromuscular conditions, congenital conditions, even traumatic conditions can be associated with it. So when it comes to idiopathic scoliosis, the causation of the condition is not really understood. There's many theories about what could possibly cause it, because typically when it's diagnosed, it's much later than what caused it. Meaning something causes a scoliosis typically young in life, a typical adolescent idiopathic scoliosis case, and it causes a small curvature. It sits there relatively quietly until growth, and when growth happens, the curves can progress. And when these curves progress, normally the causation was much earlier in life, and then when you see the progression, normally whatever caused it becomes not really 100% important at this point, because you got to deal with the curve progressing at a rapid stage. So when we deal with managing scoliosis, it's very different than what a typical chiropractor will deal with, meaning most chiropractors are dealing with injury or things that are involved with an injury type of problem. Meaning something happened, caused an injury, and then it becomes chronic over time. And this chronic problem is very slow and worsening. Idiopathic, especially in adolescent cases, can be very rapidly progressing, and they progress very rapid and very quickly, and they become more like a developmental problem than an injury problem. And when you deal with traditional chiropractic approaches, they're more to deal with chronic problems, like chronic things that have happened. Something's happened, it's progressed over a period of time, and it's causing pain or dysfunction, and then the chiropractor is trying to help restore or rehabilitate those types of injuries. And normally these are done in a different model when it comes to where you want to manage scoliosis. The issue is a lot of patients with scoliosis, especially in the adult stage, start feeling pain. And when they start feeling pain, they start seeking out care. And a lot of times the care they would seek out, meaning it'd be alternative type of care, to go to chiropractors, massage therapists, and these kinds of things. And they help treat the patient, meaning they help treat the patient that has the symptoms of the scoliosis, but the scoliosis itself remains unchanged in many cases, meaning if they're feeling back pain or neck pain or headaches or anything like that, they'll have help or improvement in those symptoms, but the curve itself is still there, and in many cases it's still progressing. And this can lead people to they're getting a kind of a false sense of security because they're feeling better, but the curve is still progressing, which can lead them, unfortunately, to a more severe case, meaning ending up getting spinal fusion again, which is what they're trying to prevent. So what does a scoliosis chiropractor do different than like a general chiropractor treating a chronic injury it happened over a long period of time? Most chiropractors that are trained in treating scoliosis have many certifications in training, meaning they go above and beyond what they just learned in chiropractic college. Because in chiropractic college, we're actually taught to not even take care of scoliosis, to actually refer patients out to orthopedic surgeons to help manage and treat scoliosis. Even though chiropractic approaches can be very effective in managing a scoliosis patient, if we add a more comprehensive program to it, meaning going on using more than just spinal adjusting, for that matter, therapy, rehabilitation, bracing, exercises. There are a lot of things that have a chiropractic approach to the problem, but you need to be certified and trained in these specific treatments to actually make a difference, or actually know how to apply them to each and every scoliosis patient. The effects of how scoliosis affect the spine are very different than how an injury would affect the spine, meaning When you're looking at an injury, normally you're looking at a very small region of the area of the spine and trying to determine how it actually affects that person, maybe which way it's misaligned and how you want to restore it. When you're dealing with a scoliosis, not only it's affecting everything from skull to pelvis and almost even sometimes the pelvis, knees, and legs, even extremities can be affected. So when you're looking at the evaluation of a scoliosis patient on an x-ray, it's very different when it comes to the structural misalignments and how to read this thing three-dimensionally, as opposed to something as simple as some type of injury that could be associated, that could bring somebody to a chiropractor. So when you treat scoliosis, when you go above and beyond what a traditional chiropractic approach would be, is I normally like to talk about traditional chiropractic approaches tend to be low dose over a very long term, meaning you're going to see patients for a very short period of time over a very long time. Maybe patients will come in 2 or 3 times a week. Maybe an office visit is like 20 or 30 minutes, and they're doing maybe a combination of exercises, maybe some therapy, maybe and mostly spinal adjusting, and most of it's to help improve function or pain. When it comes to scoliosis treatment, the model is actually inversed, meaning that the patient actually goes through a long dose of treatment or a high dose of treatment in a very short duration, something that I call intensive care. This high dose, short duration treatment is not designed just to try to improve function or pain, but to make an impact on the scoliosis, to actually reduce the curve. That's the ultimate goal of the scoliosis treatment, is to actually reduce the curve. So therefore, whatever the curve is causing will get reduced as well, because you're actually addressing the cause, not the symptoms. This requires a multimodal approach, meaning that yes, you're doing exercises and maybe some therapy, some rehab, and some chiropractic adjusting, but you're doing it in a much greater in-depth program, and you're doing it very specific for that scoliosis curve. And this concept is to actually address the three-dimensional problem of the scoliosis to get the very best correction possible or reduction possible. Traditional approaches when it comes to scoliosis, meaning traditional orthopedic approaches, are unfortunately not very proactive, meaning it's a big watch and wait game, especially when patients start experiencing symptoms of scoliosis, meaning most of patients that experience symptoms like pain that would drive them to a chiropractor, typically that's your adult patient that's gone through adolescent progression, hasn't progressed to the point where they have surgery, but now they're progressing as an adult, they start feeling some pain, and now that mostly they're just saying, well, just orthopedic treatments to say, well, you can't deal with it anymore. That's when we'll try to do surgery, but until then, they just kind of watch. And while you're watching, unfortunately, gravity is worsening the curve, making the curve progress, leading to more problems. You're searching out more alternatives, and as you're searching out more alternatives, the curve is worsening, so it kind of fuels itself, and it can be a very frustrating thing for a scoliosis patient. So chiropractic definitely has earned its place in scoliosis treatment, but it has to be a very specific type of chiropractic, meaning we know just getting adjusted won't have a big influence on the curve itself, especially when I'm talking about idiopathic adolescent scoliosis, severe cases, curves at 30, 40, 50, 60 degrees. Small curves, something like 10 degrees, may have an impact with just chiropractic adjustments, but anything greater than that, when the curves start getting relatively severe, you're looking at a more multimodal approach, and understand that there's a very big difference in just treating the symptoms of somebody who has scoliosis as opposed to actually treating the scoliosis, reducing the cause of the problem, and actually getting the spine in a better, straighter position. So we definitely recommend that you contact Scoliosis Reduction Center to learn more, to see if you would qualify for this type of specific type of chiropractic care that actually is geared towards reducing scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.